A very good evening and welcome to the session on the topic which is benefits of early initiation of breastfeeding. We welcome today's doctor for the topic is Dr. Niranjan HS, MBBS MD, Senior Consultant Neonatology, Rajaji Nagar, Apollo Cradle and Children Hospital. We welcome you, doctor.
Thank
I
you.
would like to tell all my audience that Apollo Cradle and Children's Hospital celebrate this 1st to 7th August, the breastfeeding week, very uh, nicely. Every time we do some sessions and we get our consultants and doctors to speak about the topic and, to spread awareness. As same, we have an interactive session today with our doctor where I'll be asking some questions which are the sum up with the very generic questions we get from our patients and we get from the audience itself. So we have just clubbed some of them and we'll be giving answers. If you feel you want to ask anything, you can write that on the comment section and I'll take up that questions as well. So first of all, welcome doctor again. I would like to start with my very first question, which is why does WHO celebrate breastfeeding week? Why is it celebrated on the first go? Like if we ask.
Yeah, it's been observed that the breastfeeding was low in numbers. So this is an awareness creating to improve the breastfeeding and its benefits. The aim of this awareness is to encourage the breastfeeding, which is a vital aspect of the health of the baby as well the mother. This awareness was started in 1992, and the aim by 2030 we should reach around 70% of the mothers ending up with exclusive breastfeeding.
That's great. That's great. That's great. Okay, so another question is what are the benefits of breastfeeding? As today's day and age, we have observed that a lot of people question this. So, what are the benefits of breastfeeding in the first place?
First of all, I would like to start with the breastfeeding is a noble act of a woman in her life. So breastfeeding, breast milk is a complete nutrition for the baby, which is not only the species specific as well as a baby specific. As I want to tell you, a preterm mother milk is entirely different from a term mother. So we feed the mom's own milk. And coming to the benefits, we can categorize a neonatal benefit and the infancy benefit and the adulthood benefit. So coming to the neonatal benefit, the breastfeeding decreases the infection rate in the newborn and which protects necrotizing enterocolitis and ROP in a preterm babies. When it comes to infancy, it reduces the death by 20%
That's
and
great.
decreases the diarrhea by 15% and pneumonia by 11%, and it protects against the atopy and asthma. Those baby who are breastfed as an improved neurological development as well as an high IQ. Coming to the adults benefit, so it protects against the non-communicable diseases like obesity, hypertension, and diabetes type 2. And coming to the benefits to the mother, breastfeeding helps in early uterine contraction, thereby decreases the blood loss, and also helps in losing the weight which is being accumulated during the pregnancy, and also decreases the breast cancer and ovarian cancer in the mother. So these are all the benefits for the baby and as well as the mother.
Yeah, I think I've heard one term which is colostrum. So my next question involves that what is colostrum and what is its benefit? I think what you mentioned about the preterm milk. It is associated with that. So, what is colostrum and its benefits?
Colostrum is a liquid gold, which been secreted by every mother, irrespective of term or preterm, which is thick and yellow in color, secreted by first 2 to 3 days, about 40 to 60 ml. But it has a very high calorie and nutrients, which meets the baby's demand. And also, these colostrum has a very high immunoglobulin and lactoferrin, which has an anti-infective property which protects the baby from the infection. So we call the colostrum as the first vaccine to the baby.
Okay, okay. I think we have heard of formula milk and that supplements we need to provide. So my next question is that is only breast milk enough for the baby, or we need to give them any supplement or formula food or formula milk, whatever, just to fulfill their needs?
Yeah, good question. Breast milk provides the entire nutrition for the baby exclusively up to 6 months of life. Then, along with the complementary feed, the breast milk should be continued till the age of 2 years, which is an essential for the baby's growth and development.
Correct.
Whereas the formula milk and other milk can fill the baby's tummy, but breast milk fills the baby's soul. Okay, with
Okay.
this, I tell milk is adequate for every baby and no need to supplement either with formula or any other kind of milk.
Okay. One more questions which a lot of new mothers and new the women who are pregnant, who they often wonder that how often they should breastfeed, because there's no particular, I think, data on that. So as a doctor and as a consultant, if we ask you what you suggest to our audience.
Yes. This most of the mother have the question in their mind. So initially, first 2 to 3 days, we can ask the mother to follow the time-based feeding. That means around 10 to 12 feeds in a given 24 hours. So she can feed around 2 to 2.5 hours once. Once the baby establishes a good sucking skill and as well as the mother improve her lactation, then we can do the cue-based feeding. Cue-based means the baby starts demanding by crying and other subtle signs. So
Yeah.
during that period, the mother can give around 8 to 10 feeds in a given 24 hours.
So I think that is my another question, because it actually is not particular like how much to feed and how long you should feed. It my like the question is how often do you breastfeed? Also gives birth to my new question, which is like how long and how to know that the feeding time is adequate for the child, because they are also new to breastfeed and to latch and everything else. So how do we know that we are feeding well if they are having an adequate amount of the output is adequate, and how long the time should be, like a basic.
Yeah, it's a good question again. See, initially, first few days, the baby takes a little longer time to empty the breast, say around 20 to 25 minutes. Once the baby master the art of sucking, it empties the breast by 5 to 10 minutes.
Okay.
So, how does a mother know that the baby is getting adequate milk from her? If the baby sleeps around 1 to 1.5 hours after the feed, and if the baby passes more than 6 urines per day, and of course, the weight gain is a gold standard. Check the weight if the baby is getting, I mean, if the weight gain is there and baby is getting adequate amount. So one more, what I want to tell you is, once the baby starts feeding, that means we tell them to feed every 2 hours once. So the mother should start feeding from the beginning of the first feed. So the next feed should be 2 hours from the beginning, not from the end point of the feed. For example, we started at 8 a.m. The baby has sucked, continued to suck up to 8:20 or 25. The next feeding should be at 10 a.m. So that should be the frequency.
Okay.
And the 3 points which I mentioned shows the adequacy of the feeding.
Okay. We have people who give natural birth and have C-section, right? So people who have gone through C-section, is there anything particular, like, how can I breastfeed if I had a cesarean or C-section? So, is there any difficulty or the difference between the two?
Uh, as you rightly said, the only difference as uh, breastfeeding in a cesarean and normal delivery. In a normal delivery, we initiate within 30 minutes. But whereas in cesarean section, we need to establish the breastfeeding within 1 hour.
Okay.
So it is our responsibility, healthcare workers, to room in. That means the baby and the mother should be together as early as possible in the either recovery room or in the room which their mother has been allotted. So the healthcare workers, the nursing officers, or the doctors should help the mother, a baby, to suck from the mother either in supine position or semi-reclined position.
Okay. But
So
I
these
mean,
are the,
just the time difference and little care with help of the healthcare.
yeah, time it should be initiated within 1 hour. And as I told you, the frequency is the similar as other babies, so should be fed every 2 hours once in the initial days. So once the baby established a good sucking skills, then we can switch over to Q-based feeding around 3 hours. On a given 24 hours, around 8 to 10 feeds can be given.
That's great. Okay. My next question is, like, in India, we believe, we when our child is born, we feed them with honey, jaggery, anything like that, any sweet. So, is glucose, water, sugar, jaggery, plain water, honey, anything recommended to the baby before breastfeeding? I mean, specifically.
Okay, these list, whatever you have just mentioned, we call them as a pre-lacteal feeds. These pre-lacteal feeds take the eagerness of the baby because the tummy is full. He doesn't want to suck. So what happens? It postpones the first suck and also the subsequent sucking from the mother. So thus leading to the breastfeeding failure.
Okay.
So, and also these prelacteal feeds has a high risk uh, with that associated with infection.
Okay. Yeah, because there are some myths and things we follow as traditions. So all these things may have some scientific reason. So a lot of new moms and people get confused. So I think that was one very important thing. Another, I want to ask that is there any physical discomfort or any uncomfortable feeling or something related to comfort during feeding?
Uh, it should not be. Suppose if the mother feel a discomfort or a pain while feeding, that means our attachment is not good. That means there are two things in attachment. One is the position as well as the latch. So in position, there are three things. The mother should support the baby's whole body, and the baby should face the mother. And the third thing, baby's abdomen should touch the mother's abdomen.
Okay.
Coming to the latch, this is very, very important. Latch means the baby should open the mouth wide so that it
Yeah.
covers the whole areola, not the nipple, the whole areola. Especially the lower areola should not be visualized. And third thing is the baby's chin should touch the mother breast, and the lower lip should be everted. So this is a good latch. If suppose the baby mother appreciates a pain or any discomfort, that means the baby is sucking at the nipple. So then the baby won't get any milk because the ducts are there at the level of areola. Once the baby suck at the level of the nipple, then only the milk starts flowing. So the baby ends up without milk and start biting at the nipple, which cause a lot of pain and discomfort to the mother, and as well ending up with a sore nipple.
Okay, got it. I think this reminds me of one question we were asked on YouTube. I would want to add that in the session. That sometimes some mothers who cannot feed, they some have some issue with lactation amount of the mother. They don't get the milk, and they have some people like their mothers or their sisters who have a good lactation. So if they ask them to feed, is there any the chance of affection or that attachment to be with the mother or the person who's feeding them, or
Yeah,
the birthing one?
yeah. This we call it as cross feeding.
Yeah.
The baby feeding with the either sister's milk or somebody other baby's milk. As I mentioned to you earlier, nowadays we are practicing mother mom means mother's own milk.
Yeah.
Okay, it is baby specific,
Yeah.
which changes a term baby to a preterm baby. The composition of milk is entirely different. So during this, if you give a term mother's milk to a preterm, so preterm won't meet the nutritional need which he was supposed to get from his own mother.
Okay.
As well, there is associated little risk because that mother milk is not screened for certain infections,
Yeah.
so the baby can have a chance of getting that infection, especially cytomegalovirus infection, which can be transmitted to the breast. However, HIV would have screened in the antenatal period, even that mother, but
Hmm.
CMV is usually not screened, so the chances are there. The risk is involved.
Okay. But next question is related to this, that if the mother is ill, can she breastfeed? Like sometimes mothers have some illness of any sort.
Yeah, by all means, she can continue to breastfeed the baby whenever she has this minor illnesses like cold, cough, and fever. But make sure if there are any respiratory symptoms like running nose, cough, any of such kind, she needs to cover herself with a mask. As now everybody knows after COVID what is mask is. So cover the nose and the mouth, and she can continue with a proper and strict hand hygiene. She can continue to breastfeed the baby. And there are very special circumstances where when the mother is on chemotherapy, that is anti-cancerous drugs is being used, and certain newborn conditions like inborn metabolism, where we try to avoid giving mother's milk. Other than that, rest all conditions mother can continue to feed her breast milk.
Great. When is the correct time to start the complementary feed? Like, or, they should continue breastfeeding after initiating the complementary, like, when to start actually whole meat and wheat and the giving them a whole meal, or start giving them the food of that sort. And can we breastfeed along with it? So, what is the right process?
Yeah. So as I told you in the beginning, the exclusive breastfeeding should be continued till 6 months of age.
Yeah.
The only thing which we advise along with the breast milk is vitamin D in a term basis. Because the mothers are deficient in vitamin D, so we tend to advise along with the breast milk to give up to 6 months. So after 6 months, we need to start complementary feeds because breast milk alone is not sufficient to meet the baby's demand.
Please.
But we should continue along with the complementary feeds till the age of 2 years.
Okay. Okay. I think that makes sense. Yeah. In which situation would a mother, would a mother face challenges in breastfeeding? Like, breastfeeding for new moms and the people who are experiencing it the very first time, or sometimes in the second time also for some reason they feel, they get challenges. There are some challenges.
Yeah.
So, what are the situations that
Yeah.
are
Yeah.
possibly?
A good question, and very commonly we come across in the postnatal wards. So there are two things. One is which is contributing from the mother side, the other is from the baby side. So from the mother side, the most common thing what we come across is retracted nipples. That means the nipples are buried in the breast. So baby don't have anything to latch. So during this period, the mother needs to be supported by syringing technique where which helps the nipple to come out. But it takes 1 or 2 days to happen. During this period, the mother can express the breast milk either manually or by breast pump. She can continue the express milk feed to be fed by either palada or by spoon. This is one of the commonest conditions. And this next common condition is breast engorgement, where when the mother not fed the baby completely or incomplete expression of the breast milk, the milk start getting accumulated in the breast. So the mother start feeling heaviness in the breast and pain and as well fever.
Okay.
So this mother needs to be supported with mild analgesics, that painkiller, and hot fomentations or showers, and massage the breast and express that accumulated milk. She will have pain in the first 1 or 2 expression. Subsequently, once the milk starts flowing, she will be comfortable and the baby can restart its sucking at the breast. When it is engorged, it is too firm, the baby cannot latch properly, so they end up with not feeding the baby. And the third thing is, as I mentioned you earlier, when the
Okay.
latch is not good enough, the baby end up sucking at the nipple. This leads to the sore nipple. So the mother will appreciate again the pain. So this can be overcome by applying the hind milk. Hind milk means the last part of the breast milk. She can apply or some emollient which helps her. And coming to the second part of it, that is certain conditions where from the baby side. So usually you're seeing the baby with cleft lip and cleft palate. They where they have a defect in their palate and the lips. They cannot have a good adequate seal and create a negative pressure while sucking at the breast. So these baby can have a feeding challenge. We have a different types of feeding techniques for them. The easy one is the mother can express the milk and start feeding by the spoon. And also there are few other devices like Haberman feeder and pigeon feeding. So they can feed the baby. The other thing is retrognanthia and micrognanthia. That means a very small mandible where the baby cannot open the mouth wide to have a good latch. And the last is late preterma, where the baby is little big, but maturity wise, the baby cannot. Hello, are you there?
Yeah, yeah, yeah. I think there was some issue with my side glitch of
Okay.
StreamYard.
Okay.
Yeah.
Yeah.
So
So
sorry
from
for the session.
yeah. late pretermers are the one who looks little big, like 2 kg, but when it comes to the maturity, they are not strong enough to suck from the mother. So they end up with not feeding, and also they are the one who get readmitted for the weight loss, jaundice. These are the problems. So these are the main challenges what mother can face to end up in a failure of breastfeeding rather.
One more question. It's little off from the like the conversation going on, but I remember, we got these questions last year. That some of women, like, what is the actual period of lactation to be started in a woman? Like, does it happen to a woman which growing in age, like prepare like as the body grows, or is it specifically when it's they're pregnant, that that because some people we have seen that we get absurd cases of women having they are lactating so much, even they are not having their own kids, but they are somehow lactating and all these things. So what is actual, what is the process of that?
The process of breastfeeding is usually by an hormonal change in a mother. The two hormones are the oxytocin and prolactin. So
Yeah.
these are the two hormones which are responsible for a woman to lactate. Okay,
Okay.
so the prolactin is the one which helps in, which is maximum during the night times and help the baby. I mean, to maintain the lactations. So the woman should be a pregnant to have these two hormonal changes to happen to secrete the breast milk.
Okay. Is there any other way that because of some hormonal imbalances also these hormones can, have the secretion level more in some abnormal conditions?
They can have, but both the hormones happening at the same time is not. So
Okay.
that's usually by physiological process of pregnancy is the one where they secrete the breast milk.
Okay. So we come to my next question, which is like how this year's breastfeeding week is different from the others so far.
So as the evidence is showing, there is a decrease in continuing of the breast milk once the mother resume back to the work. So the theme of our this year breastfeeding week is make a difference in the working parents. So continue to breastfeed in a working place.
Yeah.
For that, we need to support the breastfeeding for all the working women in a working place by providing a privacy space so that she could continue small frequent feeds, a regular feeding. And the second thing, these mothers need to have a paid holidays at least for 6 months, even in private as well as in public sector, to continue increase the breastfeeding. And also there should be an increased investment in breastfeeding supporting policies and programs as well in the national program too, which regulates and promote public and in private sector to support the mother to breastfeed in a working place.
I think this one's is great. As we grow in day and age, these things should also, break the stereotypes and grow. Thank you so much, Doctor. It was a great session. I think our audience will be really happy because their questions will be answered. So the answers you gave, I think, sums up a lot of things for us, made it easy for us to understand. And thank you so much for today's session. And we hope to see this breastfeeding week's agenda to come to actually fulfill the what we want from this year. So thank you so much, and
Thank you. Thank you. Most welcome. Thank you.
thank you, Doctor.